I will adjust 2 minutes for you.
Okay.
Okay. Okay, 2 minutes finished. I will adjust 10 minutes now.
Oh.
Start.
Hello, I'm Dr. Aisha, one of the doctors in the gynae ward today. Is this Mrs. Sarah Adam?
Yes,
How may I address you?
Sarah is fine.
Okay, Sarah, I can see I have gathered from the notes that you underwent a keyhole surgery, and for that, I'm here to debrief you about the surgery. But before that, is it okay if I can ask you a few questions at first to know more about you?
Okay, sure, doctor, no problem.
Thank you, Sarah, for that. Sarah, I can see that you were supposed to meet my consultant, but he is not around due to unavoidable circumstances. So, is it okay if I can proceed the consultation on his behalf?
Yes, no problem, doctor.
Thank you, Sarah. Thank you, Sarah, for that. So, Sarah, may I know how's your recovery after the surgery?
I am fine, doctor. I am fine.
Sarah, are you in pain? Sarah, are you having any pain?
No pain, only mild soreness, but I can manage that.
Okay. And Sarah, have you started to eat and drink well after the surgery?
Yes,
Mm-hmm. And are you able to walk in the ward around?
yes,
Any pain or swelling in your leg?
no,
Mm-hmm. Any chest pain?
no.
Mm-hmm. And Sarah, may I know, can you tell me why this procedure was basically done for you?
Yes, I came in the end with severe vomiting and pain, and they examined me and told me that I have a large cyst which is twisted around itself, and I have to go to the theater immediately. But they don't tell me, doctor, that they will remove my ovary. I don't know why they remove my ovary. Oh my
I'm
God.
so
Oh my.
I know, Sarah, it must be difficult for you. Surely I will be addressing that for you. But just few more quick questions to know more about you. Sarah, have
Okay.
you ever been pregnant before?
No,
Mm-hmm. Okay. And can you tell me when was your last period?
since 2 weeks.
Mm-hmm. Okay. And are they regular?
Yeah,
And how about your cervical screening? Is it normal updated?
yeah,
Mm-hmm. And are you on any form of contraception, Sarah?
yes, microgenol.
Okay. And otherwise, Sarah, have you ever, otherwise you are fit and well?
Yes,
Any surgeries in the past?
no,
Mm-hmm. Any drug allergies?
no.
Mm-hmm. And so, Sarah, and may I know how's the support at home?
My partner is very lovely man.
Good to hear that. And how and other okay. And Sarah, any okay? Thank you, Sarah, for may I know, do you have any drug allergies?
No,
Thank you, Sarah, for sharing all this information with me. Anything else you would like to add?
no,
hmm So, Sarah, is it okay if I can review your notes and have a look and your observations? Is that okay for you?
yes,
Okay. So, Sarah, as I would be discussing with you regarding the procedure, do you want me to call someone to be there with you before I discuss about the operation you
no,
had?
no, no, I can manage.
Okay, Sarah. So, Sarah, let me explain you what happened during the surgery when you arrived to the hospital, and as you mentioned that you were having severe pain. So the team of doctors, they decided to take you to the theater, and this was a keyhole surgery as planned for you. Sarah, when my consultant was there in the surgery, he opened up your tummy by giving a small cut on your tummy. Then what we found that the ovary was twisted on itself. If you look at this drawing with me, that the ovary was twisted on itself, and because of that twisted ovary, the ovary the ovary was enlarged in size. It was twisted 2 to 3 times on itself. Because of that, the ovary was not receiving there was cut off blood supply to the ovary, and it has turned black in color. So the team
Oh,
of doctors I'm so sorry, Sarah. So because of that, Sarah, what happened? The team of doctors, they tried to save your ovary, but however, it was not safe for you to save it was not safe decision in your case to save the ovary, because if it was left because this dead piece of ovary, if it was left inside, it can cause some infection, and even it can be life threatening for you. So for in the best interest of your Sarah, the team of doctors, I'm sorry to tell you that they decided to remove your right ovary and the tube as well.
okay, doctor. So why they didn't tell me that before the surgery?
Sarah, actually, your concern is quite valid, Sarah. Let me explain you that during the surgery, what could there is a possibility that it could happen. However, I would look into the matter that why it was not discussed with you before. So for that, I have already initiated an incident report to see why and where things went wrong. And once the results will be available, I will be honest and open to discuss them with you. However, Sarah, the quite reassuring thing on the other hand is that your left ovary is and left tube and the left ovary is fine. So whenever you plan to have a baby in the future, you will be able to get pregnant.
Okay,
Sarah,
so
please.
is it cancer, doctor?
Sarah, let me assure, at the moment, Sarah, we are exactly not sure that what exactly it is. However, the sample of tissue has been sent to to the exam for the examination under the microscope, and once the results will be available, we will be honest and open to discuss them with you.
Okay, so when
Mhm.
can I go home, doctor? And can I drive to till my home?
Sarah, let me explain you that at the moment we are keeping you under observation, as to make sure that everything is fine, you are able to eat and drink well. Sarah, may I know, are you able to tolerate the pain?
Yes,
And have you started taking the tablet forms of the medication?
yes.
So, Sarah, once I will have a review with my consultant that if everything is fine, we can discharge you back home, and we will be arranging the follow-up appointment for you once the test results will come back. And usually the recovery time is around 4 to 6 weeks. And once you're stable, then you'll be allowed to have your driving and and you can get back to your routine activities as well.
Okay, so doctor, why I have this cyst?
Sarah, at the moment that why you had this condition is the exact reason that why did it happen is not known. But sometimes the ovary can enlarge because of certain reasons, like if the woman is having sometimes if there's any infection in the ovary that could lead to the ovary to enlarge in size. Because of that, it twisted by itself. Because of that, it might be one of the reasons. However, once the results will come back, we'll be in a appropriate position to answer your queries in a better way.
Okay, doctor. So when
Mhm.
should I take again the contraceptive pills?
Mm-hmm. So, as far as the contraceptive pills are that the contraceptive pills that you are taking, with regards to the pills, let me explain you that the pills you are taking, you can continue taking these pills once again after you can continue taking it from right after the surgery, because these contains only the hormone progesterone, and which is safe in your condition to continue taking them.
Okay,
However, the contraception which contains both estrogen and progesterone hormone, they may not be safer one for you at this point of time.
okay.
Any other questions, Sarah, would you like me to address for you today?
No.
So, Sarah, for now, I will be informing my consultant about the discussion, and will be writing in your documents. And if at any time you feel that you're having any pain, just call me or one of the doctors or the nurses around you. Thank you, Sarah, for your time today.
Thank you. Thank you very much, Dr. Aisha. Well done. Excellent. You still have 1 minute and 9 seconds, but finish. You managed to finish before the time. Thank you very much. You did the task in a very nice way. Your communication with the patient is excellent. You use lay language um, in a very nice way. You give the information a small chunk so she can understanding. Your sympathy in the patient with the patient is perfect. Sure, that if this patient come in the exam, there will be a lay examiner. Okay, they used to bring something like that in the exam. So there's some debate or something wrong in the consent. The consent didn't taken well for the patient, like this patient and the patient who have hysterectomy and there was placenta accreta. So the examiner will be there in the exam to see how you will negotiate with the patient, how you will counsel the patient, whether you will put a blame and you will undermine your colleague, and what you will do. But the best thing is that you didn't do that, and you managed to talk with the patient and to try to calm the make the patient calm. And in the start she was angry and she was very disappointed about the surgery. Okay, so you're the way of the communication, who is the way that they decide what the patient will do. If you go against the patient and you say you signed the consent already and you know that, okay, the patient may become angry and you may lost all the situation in the exam, but your communication is perfect. Only I wanted to, before I forget, the macrogenome, it is a combined type of contraception. So don't forget
Oh,
this point. Macrogenome is a combined, so it should stop or to wait
yes.
for this type of the contraception for 2 weeks, or at least
Hmm.
the next menses. Okay, if you are not sure,
Hmm.
if she mentioned any type of contraception and you don't know in the exam, tell her that you did it in a very nice way. You said the progesterone only is safe for you, but the combined type. So you may say, I will check whether it is a combined type or it is a progesterone only type. So if it's a progesterone only type, you can take it. If it's the combined, you should wait for at least 2 weeks. For example, the role player may say a new drugs or a new contraception, and you don't know about that. So they tell her that I will check for that. I will check which type is this
Hmm.
uh, contraception you are taking, whether it's a combined type, or the progesterone only type. Okay, you may say, I will check with my consultant about that if you don't know about this at all. Okay,
Hmm.
that
Yes.
the microgenome before I forget this point. But
Yeah,
mm,
thank you, sir.
all that task, you did it in a very nice way. I want from you only for the history present illness. If you ask about the cyst itself, you ask about the event, but if you ask about the cyst itself, did she know about it before? She has any scan before? She feel that she lost weight, she lost appetite, any pressure symptoms like problem in opening bowel, problem in peeing, like that. So this to assess the cyst, whether she has any problem during sexual intercourse. She may also have an endometriosis or endometrioma, which may be the cause of this cyst. So, and this to check for the assist the cause of the cyst and whether she know about the cyst before or no. Okay, so to make the history full, you have also to ask about the cyst itself. What else I wanted to, yes, family history. You forget to mention to ask about the family history, whether she has any family history of cancer in the ovary, in the breast. Okay, also to assess her risk of this patient. She has a large cyst and removed. Okay, so if you ask about this point also, it will be amazing. Okay,
Mm.
so this is only the few things, but otherwise your performance is excellent, patient safety is excellent, communication with the patient perfect, sympathy with the patient is perfect. The patient try to push you from the start to talk. You are clever because the patient try to push you to talk about the event, to talk about, but because I think you put a template for yourself, you make an agenda for yourself, you wanted to finish the history, and after that you wanted to talk about what happened in details. Okay, so you have two ways, either to go direct to explain for the patient the surgery and what happened, and after that you go to take the history, or you do like Dr. Aisha did. You take the history first, try to postpone the counseling, try to postpone the drama till the end of the history, because you may forget to take the history after counseling the patient start to cry, the patient started to be anxious, start to be angry like that. So you may forget to take history. So please be clever, like Dr. Aisha. Dr. Aisha, try to postpone that, try to counsel the patient, try to express the concern. Yes, I understand how you are, how anxious you are, or how upset you are, but in a moment I will come to explain what happened for you. But before, it's the first time for me to see you today. Can I ask you some question to know more about you? Okay, so try to put a template for yourself. Try to move the scenario as you like, not as the role player like. Okay, because in the exam, because of the stress of the exam, all of us have gone through this. The stress of the exam, you may forget some point, and you will forget some point sure in the exam. But if it's small point, no problem. But if it is large point, it will be a very big problem. So I will counsel the patient after I finish the history. So if the patient try to push me, I will try to defer that till the end of the history taking. Okay, Sarah, I understand your concern. I can see how upset you are. But because it's the first time for me to see, can I ask you to see you today? Can I ask you some question to know more about you? At the end, I will talk with you about what happened and what is the suggested plan for you. Is it okay? Sure, she will say okay. Okay, so if you ask about the background of the surgery from the start, it will be also perfect and perfect. So do you know about what happened in the surgery? She will tell you that I know that she removed my ovary and. Okay, so you know that the patient already know, had a background. The patient know that she removed her ovary. Okay, sometimes the
Mm.
patient may know, don't know, so you will come as, because it may come as a breaking bad news. For example, if you remove the history, the uterus, for example, and you come to talk to tell her that we removed your uterus, your womb, so it should be done as a breaking bad news. So you should know whether the patient know or the patient don't know. So if the patient come from the out from the surgery and it's not clear from you in the instruction outside whether the patient know or no or don't know, try to check the background. Do you know anything about the surgery? Do you know anyone to come to talk with you about the surgery? Okay, if it's not clear outside, you are the first one. You will talk with the patient, or you are the first one to tell the patient that she removed her uterus and. Okay, if it's not clear for you, if it's clear, if the instruction is clear, okay, that's okay. So ask about the history of present illness. The good thing that you ask open question. Very good. Very good to start the history taking by good question. Okay, so could you tell me what happened? Very perfect and very nice question. I like this question too much. Could you tell me what happened? She will tell you everything. If she forget to mention anything, try to address this point or to ask about this point. After talking about, she will tell you that I have pain and vomiting and. Okay, so you may ask about the test itself. Did you know before about this test? Did you have any scan before about this test? Did you feel that you lost weight in the last couple of months? Did you feel loss of appetite in the last couple of months? Any problem in opening a bowel? Any problem in peeing? She will say, no, no, everything is fine. So go to the recovery. So after taking the histopathology, let's go to the recovery. Okay, did you start to move around? Did you start to eat and drink? Did you manage the pain by simple painkiller or by the tablet form? Okay, this is to check about around it. Did you open your bowel? This is to ask about the recovery. Then go to the remaining history. Ask about the gynae history, the sexual history to assess the risk factor and what is the maybe the possible cause of this cyst. You mentioned that she is on microgenome contraceptive, combined oral contraceptive. Okay, she may ask you, can I start it again? Okay, the combined can be started 2 weeks at least after the surgery. Okay, then you don't, as we mentioned, don't forget to ask about the family history to assess the risk factor also for any cancer in the family. Then come to explain for her. Dr. Aisha examine or counsel the patient about the surgery in a very nice way. She try to deliver to the patient that there was a very big thing, and we save your life. So the patient will thank you instead of make a complaint. She will thank you. So there was a very big thing, and your life was in danger. And because we are a good people with you, we remove your ovary. So please thank you. You should thank me about that. So the patient now will be very, very polite and she will be very calm after this counseling. So during the surgery, the cyst, there was a very large cyst and this filled with, sorry, and this filled fluid sac inside the ovary, and um, it make your right ovary and tube twisted around itself, and so the blood, excuse me, just a second. Okay, so because of this large cyst in the right ovary and the right tube was twisted around itself and the blood supply was cut off, so we have to remove this to save your life, because if we leave it, it will lead to infection and the spread of toxin in your body, and this will affect your life. Is it clear? Okay, so there was a very big thing and we save your life for this thing. If we lifted the ovary, your life will be in danger. So he may say, okay, doctor, so why no one tell me that before the surgery? It should, ideally, it should be in the consent. Any woman will go for surgery in the ovary, like a cyst or anything. She should be consented for a possible oophorectomy and salivingectomy. But sometimes it may happen in the emergency. So please don't put blame or don't undermine your colleague. So, but we have to assess the patient safety, and we have not to ignore this concern of the patient. Yes, what is her name? The patient name, what is her name? Her name is Sarah, yes. So Sarah, yes, I totally understand your concern, and ideally it should be done before the surgery. It should be involved in the consent, but it may be because of the emergency situation, and the or of my colleague was dying in a rush to save your life. But I wanted to assure you that there will be an instance report will be written, and there will be a group of expert doctor collect the information and will give you clear explanation of what happened. Okay, so this would trigger an instance report. She will ask you about the effect of this on the removal of the effect of the removal of the ovary on the pregnancy. Yes, sure. It will not affect her ability of pregnancy. She can be pregnant whenever she think about the pregnancy. It is a sinister cells. It is a cancer. We don't know till now, Sarah. Until now, don't know, but it is very unlikely in your age group, and also she doesn't have any risk factor in her history. So most of the cysts will be benign, but the cyst will be examined in the lab, and they will give you after the result, we will give you appointment to discuss the result with each other. Okay, so when can I go home? She can go home once she can eat and drink. She can control the pain with simple painkillers. Okay, but regarding to the drive, she can drive only if the pain is settled and the pain can be managed by the simple pain killer. Any patient would go home after surgery. You have to warn her if she have a severe pain in her tummy. If she feel very unwell, she should come back. So give her the warning sign. Thank you, Aisha.
Thank you so much for the opportunity, sir.
Yes, Dr. B, can you mute yourself, please? Um, yes, that's fine. Okay. Dr. John, are you with us? John. Dr. John, are you with us? Okay. Mhm. Dr. Tanya, are you with us? Tanya?
Yes, sir. Hello?
Hello. Yes, I can hear you.
Yes. Yeah.
Okay, good, good, good.